Hey guys, I am back with another FMG question. So let's begin. So a deep vein thrombosis patient was started on an anticoagulant therapy. Next is the patient presented with the features shown in the diagram below. What is the likely drug implicated for this adverse effect? So as you can see in the diagram, we have gangrene. So options are option A is heparin, option B is warfarin, option C is the rivaroxaban, and option D is the dabigatran. So try to answer this question. This question is a little difficult. So we need to understand what is deep vein thrombosis. So it's a medical condition in which formation of large blood clot thrombus within the deep veins of the body occurs, mostly in the legs. Okay. It typically occurs in large veins like femoral or popliteal artery veins, but can affect veins in other parts of the body. So the risk factors for this DVT are the prolonged immobility, surgery or trauma, pregnancy, hormone therapy, obesity, medical condition, and genetic factors. Okay, so let's learn about the vitamin K. So what is this vitamin K? It is a vitamin which is required for the coagulation cascade. Okay, and it activates the collating factors like factor 2, prothrombin, 7, 9, and 10. 2, 7, 9, 10. These are very important for the examination point of view. Vitamin K activates collating factors 2, 7, 9, 10. 2 is also prothrombin. Okay. So, calcium binding and clot formation, the carboxylated clotting factors in the presence of calcium ions form a complex that activates a series of enzymatic reactions known as clotting cascade. Okay. Now, regulation of anticoagulant proteins. So, vitamin K also contributes to the production of anticoagulant proteins like protein C, protein S, and protein Z. Okay. Without sufficient vitamin K, the synthesis and activation of clotting factors are impaired, causing prolonged clotting time and an increased risk of bleeding. Okay, so in this slide, the important points are this one, okay, this one, and this one. Okay, guys. Now, so now we will understand what is warfarin. So, warfarin is an oral anticoagulant medication that is widely used to prevent and treat blood clots. Okay, it belongs to a class of drugs known as vitamin K antagonist. Now, what do you mean by antagonist? Antagonists are the substances which oppose. Okay, antagonism means opposition. Okay, so mechanism of action of warfarin, it works by inhibiting the activity of vitamin K epoxide reductase, we call. Okay. So this enzyme is involved in the recycling of vitamin K. Okay. Vitamin K is important for the synthesis of several clotting factors in the liver, and warfarin's inhibition of VKOR reduces the availability of the active vitamin K. This in turn causes decreased production of clotting factors to 7, 9, 10. Okay, to 7, 9, 10. Actually, the vitamin K, it gamma carboxylates these factors, therefore activating these factors. Okay. So, so the warfarin, it increases the clotting time. That is the PTT. What is PTT? PTT. It is the partial thromboblast time. Okay. So indications. Warfarin is commonly prescribed to prevent and treat conditions characterized by the formation of blood clots like deep vein thrombosis, pulmonary embolism, and atrial fibrillation, and mechanical heart valve replacement. It is also caused by it is also used for the prevention of a stroke in individuals with certain the high risk of cardiac condition. Okay. Now coming to the purple toe syndrome. So purple toe syndrome is a rare complication associated with the use of certain medication including warfarin. So it is characterized by the sudden development of purple or blue discoloration of toes along with pain and sometimes skin lesions. Okay. So causes of this is by the formation of a microemboli, which are tiny blood clots that block the small blood vessels in the toe. These blood clots can obstruct blood flow, causing tissue damage and discoloration. Now we actually don't know the mechanism, but it is thought to be in a relation with the medication and associated underlying factors. Okay. Now, medications. So, medications which can cause purple syndrome are the warfarin, which is the vitamin K antagonist. Okay. So, symptoms. The hallmark symptom of purple toe syndrome is a sudden appearance of purple or blue. Sudden. Okay, this is important. Sudden appearance of purple or blue discoloration of one or more toes. Okay. The affected toe also may also exhibit pain, tenderness, and sometimes skin lesions like ulceration or necrosis. Ulceration, necrosis. This is also very important. Okay. Okay. So as you can see in this diagram, this is the diagram depicting the purple toe syndrome. As you can see, there is a purple discoloration of the fingers, of the toes, and all stuff. Okay. Heparin. Heparin is an anticoagulant medication that prevents the formation of blood clots. Okay, but the thing between the heparin and warfarin is the difference in the mechanism of action. Warfarin acts on the vitamin K epoxide reductase enzyme. Okay, it inhibits this enzyme by blocking the vitamin K epoxide reductase enzyme. But in the case of heparin, it works by enhancing the activity of antithrombin 3. Okay, uh, which, i- which is a natural substance in the body that inhibits blood clotting. Okay, by binding to antithrombin 3, heparin accelerates its ability to inactivate clotting factors, particularly thrombin and factor 10. Okay, thrombin and factor 10. Okay. So this inhibition prevents the formation of blood clots and helps to keep the blood flowing smoothly. Now, heparin versus warfarin. Heparin and warfarin are both anticoagulant medications used to prevent and treat blood clots. However, there are differences in the mechanism of action, route of administration, monitoring requirements, and indications. Okay. So now talking about the mechanism of action. Heparin works by enhancing the activity of antithrombin, a natural substance in the blood that inhibits blood clotting. It mainly inhibits thrombin and factor 10A, preventing the formation of blood clots. Okay. Now warfarin. Warfarin is a vitamin K antagonist. Okay, that interferes with the synthesis of clotting factors in the liver. Okay. It also inhibits the vitamin K epoxide re- reductase. Uh, okay. So this causes a decrease in levels of clotting factors to 719, to 719, to 719. Just remember this thing. 2719, 2719, to 2719. Fine. 2719. Now, talking about the route of administration, so heparin can be administered intravenously or subcutaneously under the skin. Intravenous heparin is often used in hospital settings, while subcutaneous heparin is commonly used for long-term treatment, long-term anticoagulation, or as a prophylaxis for the deep vein thrombosis. Okay. Warfarin is taken orally in the form of tablets or capsules and is typically self-administered by the patient at home. Okay. Indications. Heparin is commonly used for treatment of DVT, deep vein thrombosis, pulmonary embolism, and during certain surgeries or procedures. It is also used for maintaining blood flow in certain medical devices like catheters and dialysis machines. Now warfarin. Warfarin is used for long-term anticoagulation in conditions like atrial fibrillation, mechanical heart valve, and to prevent recurrent blood clots. It is not typically used for acute management of a blood clot due to its slow onset of action. Now coming to the third option, rivaroxaban. It is also an anticoagulant medications. Uh, it belongs to the class of direct oral anticoagulants (DOACs), and this rivaroxaban works by inhibiting factor 10A. Okay. Heparin works by promoting the action of anti-thrombin 3, and warfarin acts by inhibiting the vitamin K epoxy reductase enzyme. Okay, so these all anticoagulants, they are helpful in preventing the blood clots. Okay, now indications. Okay, prevention of deep vein thrombosis in individuals undergoing hip or knee replacement surgery. Okay. Treatment and prevention of DVT and pulmonary embolism. Okay. And prevention of stroke and systemic embolism in patients with non-valvular atrial fibrillation. Okay. Now, can rivaroxaban cause gangrene? So it can cause gangrene, but the incidence of causing the gangrene is very low. Okay. Now dabigatran. So it is also a direct oral anticoagulant, and it works by inhibiting the thrombin. Okay. It works by inhibiting thrombin. Thrombin is a procoagulant. Okay. Which means it directly inhibits the activity of thrombin occluding enzyme in the blood. By blocking the thrombin, dabigatran prevents the formation of blood clots. Okay. Now similar question: can dabigatran cause gangrene? So you know risk of developing the gangrene as a direct result of a dabigatran therapy is extremely low. Okay, so our answer will be warfarin purple toe syndrome. So in this case, you need to know what is deep vein thrombosis, especially what is thrombosis. Okay. Then you need to know about the drugs used to treat the deep vein thrombosis, that is heparin, warfarin, rivaroxaban, and dabigatran. Okay. You also need to know what is the mechanism of action of all these drugs. You need to know what are the indications and contraindications of these drugs. Okay. So thank you guys. Bye.